You probably already know that colostrum is the first step in starting calves off right. But what are the other factors that come into play? Welcome to Beyond Colostrum, the show where we'll talk about how to optimize your calves with science and research that goes beyond just colostrum. We'll challenge the ways you typically manage your calves, and you might learn some new concepts beyond what you're already used to. Thanks for joining us as we go beyond colostrum. Good afternoon, everybody. I'm Michael Chubb, the Managing Director of Saskatoon Colostrum, along with Dr. Mike Nagorski and Dr. Travis White, two of our technical veterinary specialists, to talk to you about dystocia calves and dystocia and colostrum. But before we get there, I wanted to look back at our last episode where we talked about thermogenesis and the role of colostrum in assuring those frozen little calves that hit the ground in the Great Plains in February get what they need so they can focus on growing as opposed to just surviving. That was our last episode. And now that we're transitioning into the warmer weather, I'd like to shift gears and think about issues of dystocia, hard pulls. So first, Dr. Travis White, tell me what you would define dystocia as.
Yeah, so dystocia would be any kind of difficult calving scenario that we run into where the calf isn't born in a normal presentation within a normal time limit. So things like extended periods of calving where the cow has been in active labor for an extended period of time, 30, 40 minutes, up to an hour. Issues where we have to maybe manipulate the calf and pull the calf, even things like hard pulls, and at the worst case scenario, C-sections. So these are, oftentimes the different presentations that we have where, again, we have this extended period of time where maybe we didn't see the cow in a timely manner and intervene in inadequate time period. Or again, like these calves that are hard pulls. I had an experience when I was in private practice where I had a client call and he says, "Hey, I'm having trouble getting this calf out. I need your help. I'm on my way." Rushed it into the clinic. When he pulled in, the calf was halfway out of the cow, had been there for an extended period of time. We were able to get the calf out and get it revived. It was kind of on the verge of death. But one of the biggest things with those is then how do we manage them afterward? What do we do with this calf that we know is stressed,
Right.
that we know has been under extreme stress from calving? And so now we have to have a plan of how we deal with them.
Right. Okay. So can you give me a story? I mean, you're a practitioner in the Great Plains beef realm, and I imagine you've seen some pretty sad or challenging conditions with dystocia.
Absolutely.
What have you seen that's worst?
Yeah. So, again, worst case scenarios, we get a calf that's hip locked and we have to do a lot of manipulation to get that calf out. Or even with C-sections, C-sections to some people can seem pretty innocuous, but that calf hasn't gone through the normal birthing process. And so there's certain neural pathways that get stimulated during the event of normal calving. And when we don't do that, then again, just a C-section, as simple as maybe that sounds, can kind of set these calves up for failure because they're not stimulated to breathe. We're doing a C-section for a reason. So the cow's been calving for an extended period of time and is unable to pass the calf normally. And so that calf is under extreme duress by the time we get it out. Again, this example I gave of the calf halfway out of the cow, it's purple, unable to take deep breaths. It's just kind of shallowly breathing. Again, there's a lot of worst case scenarios out there, and oftentimes they result in a live calf, but because we don't intervene appropriately, then the calf ends up expiring later.
All right. Thanks, Travis. So, Dr. Mike, what impact does that tough calving really have on the calf, and then also on the producer, and I guess sometimes even the vet? What's your thoughts on that?
Yeah, it's never an easy scenario, and really it's it hurts the calf the most, and it hurts the pocketbook of the producer at the end. And the one in between, if it's the vet or if it's the producer, it's the work to try to get that out. And no matter who we are doing that, a lot of times, unfortunately, those experiences don't end up the way we want them to. But hopefully they do. And unfortunately, there's consequences to it. So, I think the biggest thing too, you look at like calf pullers, for example, they put a tremendous amount of pressure on those calves as they're pulling them out. And we don't always have that convenience of having the ability to go straight to a C-section. I think Travis and I, we both worked where we were able to do that quite regularly, had a surgery street right where our cattle were, and be able to perform those, but that's not always the case. And so, when you go through that and then you look at what kind of stress it puts on those calves, when, especially if you pull, or it goes through those long-term periods of where that calf's not being born. And, that calving process is a timely process. You get past, as Travis said, a half hour in labor or so, those calves start to lose oxygen. And so if it's not only just a difficult pull, you got oxygen deprivation that can be affecting these calves, so there's a lot going on, and to the effect, it's got the big effect on the calf, but then the people and all the consequences with it. So dystocia is never a fun word to say.
Does that dystocia and that hard pull and, a calf that's half purple, as Travis says, what does that do in terms of the calf's ability to absorb whatever it's going to get, whether it's maternal colostrum or a supplement or a replacer, or even, what does that do?
So Travis, interject here where you can, but when we look at passive transfer, what we're trying to do in a normal situation is give these calves an immune system. They're born without any immunity, very unique creatures in that sense. We as humans are born with a halfway functioning immune system because we get some of our immunity through the placenta from our mothers as we're going through gestation. Calves, completely different. They don't get any immunity, and they depend completely on colostrum. And so, this kind of goes through that a little bit. So you have a calf that's born, and we always say colostrum in the first 24 hours was really important, and that the gut, their intestine, is open to the passive transfer of these things called antibodies in that colostrum. And once that's absorbed, goes through their bloodstream, and then it's becomes part of their immune system for the first couple months of life until their own immune system. And so these antibodies are what's resecreted back out onto the gut and the lungs to provide that immunity. You take that immunity away, they have a 4 times more likelihood of dying before 60 days of age. So passive transfer is everything. Now, we may think, and what's kind of interesting is if we look at these calves, and I always ask this to people, I'll say, of all the antibodies that's in colostrum, what percentage, do the calves actually absorb? Most people say, well, 100%, right? So whatever antibodies in that colostrum, they're going to absorb 100% of that, some guess 70%, but it's not as much as we think. And so here we've got a graph showing the timeliness of how this gut's opened, right, in that gastrointestinal tract. And we can see that we know that given these calves within the timely process of, within a couple hours, they're going to absorb the most. And so when you look at this graph, with time, that's the absorption percentage on the left-hand side. And then with time, even after about 12 hours, there's diminishing returns on their ability to absorb. So going back to that question, how much of these antibodies do they absorb? We see this in this graph that maybe maximally upwards of 45 to 50%. But when we actually look on the average, normal calves will only absorb about 30 to 40% of the antibodies that they're presented in their gastrointestinal tract.
So you're saying in an optimal situation, when the calf comes out, not under dystocia, not under a hard pull, it's only going to absorb 45% max of whatever antibodies are in whatever colostrum it's getting, whether it's maternal or powder or what have you.
Right.
So
right.
So dystocia calves, we're talking disaster.
Much different. So here we can see that. So you're looking with the dystocia calf of about a 35% reduction in apparent efficiency of absorption, which is what we're talking about. That percentage of IgG or antibody that they can absorb through their gut. So normally 30 to 40% in a normal calf. When we throw dystocia in, it can be 20 to 25% is what studies have shown. However, Dr. Travis and I have seen calves only absorb 5 or 10% of the antibodies they're given, depending on how much stress they're given. So it's very profound.
Travis, looking at those slides, but also thinking about your experience, you find a producer, big or small, cow-calf operation or a dairy operation, and somebody's survived through dystocia. What would you recommend as the best practice, considering the absorptive capacity is as compromised as Mike's slides show? What would you say?
Yeah, from the newest NOMS data that we've got, it's become apparent that calves need to get, upwards of 300 grams of immunoglobulin within the first 12 hours of life. Now, if we take those numbers that Mike just presented, and we see this conservatively 35% reduction in AEA, well, now we're talking 400 grams just to get to the same level. So best recommendations on these calves, a lot of them aren't going to get up and nurse quickly after the dystocia event. So just giving a full replacer dose of 200 grams of immunoglobulin. Yeah. And then hopefully, if things are working right, then soon after that calf's going to get up and be able to nurse mom and go on and live a healthy, normal life. But if that calf is still slow to get up, isn't really responding that well, then following up 6 to 8 hours later with another 100 grams of IgG, so we can at least get that bare minimum of 300 in, and then it can intake some maternal colostrum from mom. But yeah, we've really got to up our game. We got to be a lot more cognizant and treat these calves with a little more attention, because we've got to get a high level of immunity into them very early on.
Yeah. Well, it's interesting. We call this little podcast Beyond Colostrum. So Mike, tell me, besides colostrum, what other practical activities can we do with or to around the calf to deal with dystocia?
Yeah, one thing that can happen, unfortunately, with dystocia, we're dealing with a lot of anatomy. We're bringing this lifeless creature into this world, and hopefully the opening they have to come into this world is big enough. And that, unfortunately, you don't have that with, let's say, first calf heifers or too big of calves in that. So one of the things that happens to these calves going through the birth canal is they can crack ribs, believe it or not. We've done ultrasounds on calves where we can see fractured ribs and things of that nature. And so when you have that kind of compression, especially with a difficult calf pull, I can't remember the exact numbers, but the tension on those calf pullers is quite profound. It's I believe over 800 pounds of pull on it. So you're talking about a lot of inflammation and pain, if you will, on some of these animals that are in that. So one of the common practices is to actually give anti-inflammatory like Banamine or meloxicam, and meloxicam is fairly cost-effective solution. You can, a lot of those tablets come in 15 milligram tablets, can give five of those tablets per 100 pounds of body weight, and that's a good practice. If they have that, the other big thing that we want to do, if they're in a C-section scenario, there's a process called a Madigan method. These calves don't typically go through that birth canal, and there's a neurologic response they have when they do go through that kind of wakes them up. And so a lot of times in a C-section scenario, you can get calves that are just kind of lifeless. And they've done this in horses before. And Travis, I think you've done this before with calves, even more than I have. And maybe you want to talk about that a little bit.
Yeah, so the Madigan squeeze is just or the Madigan technique is you place ropes at specific locations on the calf, and you squeeze that thoracic cavity to simulate the birthing process. And what that does, it kind of resets the neural pathways of the calf. And so if a calf is sluggish, doesn't really want to get up and get going, then we can perform this Madigan squeeze to kind of reset the neural pathways, get them up and moving. Things like, taking a piece of straw or some other foreign body and stimulating their nasal passages so they take some big deep breaths to get those lungs expanded is also key. But yeah, I've used the Madigan squeeze quite a bit in practice, and it worked very, very well.
Madigan squeeze kind of sounds like an NFL move. Yeah,
Yeah,
Charlie's going in for the Madigan squeeze. Well, I think it's a little bit different for you guys, but I can totally see that. You think about that, open up and you're pulled out with any pressure. I would imagine our physiology would be different as well. So, those are really good tips to keep in mind for these tough calvings, these dystocia events. And I guess we never know when the scenarios are really going to occur. So it's pretty important to have a plan in place, and obviously the colostrum replacer on hand after that little creature's been so stressed. So thank you both for the insight and perspective today. And I'm sure we'll get together soon for another chat about beyond colostrum. Thank you, guys.
Thank you.
Thank you for watching today's show. If you have questions about something you heard today, or maybe you have a topic you'd like us to address, leave us a message on Facebook. We'll talk again on Beyond Colostrum.